Good afternoon, and thank you for joining us today. I'm Aisha McCracken, founder of Ignite Healthcare Network and president of Innovate Health Ventures. Earlier this year, following the impact of COVID-19, Ignite Healthcare Network surveyed over 100 startups to see how they were faring. This Igniting Innovation webinar series came together as a result of feedback from that survey. The 4 roundtable sessions that we have set up have been designed to continue cultivating the conversations between healthcare startups, their customers, and investors during this very dynamic and uncertain time for everyone. I'd like to thank our long-term partners at TMC Innovation for their continued support in bringing this webinar series to you. Last week, we launched the series with a great panel led by investor entrepreneur Chantal Preston, discussing the investing and raising capital, how investing and raising capital looks in today's environment. If you missed it, you can find it on Ignite's website under programs. Today, we're going to explore how this pandemic is changing the way startups and their potential customers are engaging. The question is, through this chaotic time, what are the challenges and opportunities for continued innovation? We've assembled an outstanding panel of experts who are truly in the thick of this situation. They're kind of living it 24/7 to share their experiences and insights with us. I'd like to now invite each of them to briefly introduce themselves. So let me start with Karen Hill, if you'd get us started, Karen.
Hi, good afternoon. I'm so happy to be here. I am the corporate SVP of Products and Program Management at Health Help, which is owned by WNS. Health Help is a company that does subspecialty utilization management and works with quality care for our members. Just in background, I am a physician who is an internist and a pediatrician by board certification. I was in private practice for a number of years, too many to count, particularly since I'm still 29. And I've been in managed care for, again, too many to count, several companies. And I'm just happy to be here and hopefully can provide some insight going forward in these crazy times that we're in this pandemic and otherwise. Nice to be here. Thank you.
Thank you, Karen. Myra?
Hi, thank you for having me. I'm Myra Davis, and I'm the Chief Information Innovation Officer here in the Texas Medical Center at Texas Children's Hospital. Thank you for having me. I'm really excited to be here. Like Karen, really excited to share my perspective on what's happening during this very different climate that we're in. I've been at Texas Children's for 17 years, and most recently for the last 12 to 18 months in this role where I've inherited the innovation component of the information services. So looking forward to the discussion.
Thank you, Myra. Tracy.
Hi, I'm Tracy McNeil. I'm president and CEO of Materna Medical, a women's public healthcare medical device company. And I'm also the national chair of AdvaMed's Women's Executive Network. So that is a place where we bring the top talent in the medtech industry together and amplify women's voices. And so I'll be bringing the perspective of the medical device industry, I think, to this panel and how COVID's changed things for us. Thank you for having me.
Thank you, Tracy. And Michelle.
Hi, thank you again. I'm like the other panelists, just looking forward to this conversation. But Michelle Stansberry, I'm with Houston Methodist in the Texas Medical Center. Have been there 27 years. Still can't believe that some days when I say that. It's been a very rewarding career. Half of my job is being the vice president over our Center for Innovation, and then my other hat I wear is our vice president within our IT over our corporate revenue cycle systems. Looking forward to our conversation.
Thank you all. And to our audience, you can see that these women all represent innovators from a variety of different perspectives, whether it's technology, whether it's med device, whether it's startup, or institutional organization. So we tried to bring together as many different voices to have as comprehensive a conversation as possible. So let's get started. I think most healthcare organizations over the course of the last several years started to create a process and a group, an innovation strategy. They've been embracing innovation and developing these internal processes for assessment and uptake. So what that looked like, maybe December, January, February, well, I'm not sure, February things probably started to wobble, but would love to get a sense from you all as to how your organization's priorities and processes have changed. So let me start with Myra, and give us a sense of what's happening at Texas Children's Hospital.
Yeah, so I would say starting end of February, early March, with the onset of COVID, the pandemic, we really accelerated our telemedicine world. We went from visits that were less than maybe 100 a day to where we're now seeing over 3,000 visits every day. We did that in record time. I would say fast as lightning. My team played a phenomenal role here. And we are now looking at how to sustain it. Most of our activity, about 30 to 40% of our activity are still with telemedicine visits. But now it's a question of what's next. Not only are we looking to sustain it with revamping or changing the workflows to accommodate the visits, we're also looking at the ability for patients or caregivers of the patients to schedule those visits directly into a video visit. And then we're also looking at ways to make it easier for our providers and our patients to really use this technology. So that has definitely changed. We've also made some significant changes just in how we schedule appointments. We call it a zero-touch world now, to where we really are trying to get our caregivers of our patients and our moms for our women in OBGYN area to do as much as possible online before coming in to the visits. So all the pre-paperwork, all the co-pays, all that, we're looking for them to do it electronically. So when they come, it's a matter of a check-in process that we know they're there. And then there's an in-person visit. And when they leave, it's more, everything happens via the patient portal. So basically reducing their touch point to any tangible item in the environment as much as possible. And we've had to pay very specific attention to it by focusing on the patient journey.
So as you go through that process and innovate, how much of what you're doing is done with internal resources, and how much are you engaging startups with some technologies to help manage this transition?
You know, with this one, most of it was done, if not all of it, has been done with internal resources, really just accelerating existing platforms that we had. So I would say in this case, we did not leverage any startups for this endeavor.
Okay, thank you. Michelle, what's happening with Houston Methodist?
Sure. I guess similar story to what, Myra had talked about. I will tell you our Center for Innovation was very active prior to COVID hitting us. And the interesting part about it was when COVID did hit with us, our Chief Innovation Officer, which of course is Dr. Roberta Schwartz, she called us all in and said, we've got this situation now with COVID, everything that we've been doing with innovation, what can help? And, I think there were several things that we had been working on that really helped us to be able to, it helped prepare us for what taking care of the patients. One was, of course, our telehealth. We've been doing it for almost 2 years. Somewhat a little bit low adoption rates, but now that clinics were closing, people needed to be able to see their physicians. It just jump started to where within a 2-week time frame period, we had to end up training several hundreds, almost around 800 physicians, clinicians on how to do telehealth. Fantastic. Same numbers, kind of what Myra talked about, kind of, low 100s now, several thousands per day. The interesting part about for us was we really wanted to understand how it was going to level off. During the second surge, you can see where our numbers, they did somewhat kind of level off as our clinics opened up. We still have our clinics open today, but we're still seeing a high number of telehealth. We also had other innovations with our virtual ICU. that was a project that had started in our main hospital. We had plans over kind of a 2-year period to really roll it out across our other entities, but fast track, and I've heard the term COVID speed. It has kind of, yes, hit our institution as well, as how could we quickly get that up, because we needed to be able to have a way to help monitor the patients, have that two-way communication without necessarily the physicians or clinicians going inside the room with the COVID patients. The other thing that we had somewhat started, and it's vastly expanded across our organization now, which was putting in iPad devices within overall in our rooms. And it was kind of twofold. One, it was again, just kind of a communication method, but because these patients were not able to see their family members, we wanted them to be able to have that connection back. So it was a way for them to be able to communicate with family, have some sort of other type of entertainment. They could log into their Netflix, they could do some other type of activities. And then one last piece was on our Care Sense, which was our overall care plans. We were using that as a communication method too for patients on telling them what they needed to do before they come into the institution, and then actually as a follow-up. We used a lot of that for, from our COVID, testing and results and things going back out. So I will tell you, did things slow down for us? Slightly, but the innovations that we had in place that we were kind of piloting and working on really helped to set the foundation for us to quickly change and manage and be able to take care of this population.
I have to remember to unmute myself. So same question for you. As you describe all of the things that you have underway, innovation that is internally sort of developed versus connecting with startups that may have a start with platforms and efforts that can really help accelerate what you guys are doing. How does that play into the way that you're managing through this change?
Sure. I will tell you from Houston Methodist and our perspective, the way that we handled innovations, well, we looked at organizations that weren't true startups. They were looking for beta partners, right, or alpha partners to really do co-development. We were looking more for companies who had a product. Maybe they'd already piloted it in another institution, but they were looking for a large healthcare system to take it and expand it across. So that was kind of our model. I will tell you, we've slightly shifted. We are in a co-development process right now with Amazon, looking at voice technology. We really believe that voice is kind of the wave of the future here. And so, it may be somewhat of a mind shift now for Houston Methodist. I can't say how much more that we'll do, but it's when we look at true startups, we're not looking at true, let's just do the alpha and the development. Now, what we are doing within our technology hub is that we look for companies, that have maybe a good product and they want a place to try to come in and utilize our EMR or some of our other medical device, integrations that we have to see how they can make it work within this large healthcare system before we even take it out and pilot it. So I will tell you, we have looked for those organizations who truly have a product now, and they're just looking for a large healthcare system that wants to expand it across to see how it works.
Thank you. Very helpful. Since we're talking technology, I'm going to go to Karen. So with Health Help, how have things changed with COVID, and what are you all doing in terms of your products? As you lead products, I suspect a lot of this work and innovating around products lands on your list of responsibilities.
It does. And I think we're more similar to a more traditional company where I think the biggest hurdle was shifting our personnel all at home. And that was done in a matter of days. And I think we're still refining that since none of us know really how long we're going to be home. We have seen some, improvement. I mean, we're working just as hard, if not better, at home than we were in the office. So those may be some aha moments we have in this type of pandemic. But we also sell our products, which are utilization management products, to clients. So on the flip, you know, we're looking at better ways to engage in mechanisms like this. We're on a Zoom now, but what is the best format to have a meeting? How do you engage that client during the meeting? Because, you know, if none of them show their faces, they're often multitasking. You know, you can't read body language when you're trying to sell. So these are all things that we're trying to navigate now as we're trying to sell our products. As far as innovation with products, our healthcare products are pretty stable. You know, we are selling the method of producing quality healthcare and doing utilization management to make sure that our members that we're serving for our clients are getting the best healthcare, the right place, at the right time. That platform really hasn't changed much. Those rules are the same. Healthcare has remained the same. But how the physicians engage with us, I think there's an increase in web engagement where a lot of people were faxing and maybe phoning before. You're getting more interest in that. And so those type of technologies are the things that we're looking for to move going forward. But engaging our clients and having a safe work environment from home, those are our top ones right now.
Great. Thank you. I'm going to switch the conversation from tech to device. And so Tracy, as a startup, early stage, right? That how have things changed for you? How are you engaging with customers, and what is that looking like in today's environment?
Well, so we have two products. One of our products is called Millie. You can see it online. It's available direct to consumer as well as through clinician offices. It's millieforher.com, and it's a device for chronic pelvic floor tightness. And this is a market that's 5 times the size of the erectile dysfunction market, and yet women don't talk about it very much. And it's been a really interesting thing for us to work with our customers in this environment around quarantine. So people are stuck at home and trying to work on these issues. We've worked a lot with our clinicians and our scientific advisory board to really quickly pivot and do some video content to help women at home trying to work with this, because it's a condition that I liken to sort of, I get the Quasimodo neck where I get like stressed, and, you know, and I go to physical therapy and I can stretch this muscle out because it crosses a joint. But the pelvic floor is in a circle. So a lot of times when women end up with this issue, it affects men too, but when it happens, they don't know what to do, and they do need clinician guidance. And just like all of my colleagues here, clinicians are all at home too. And so trying to help connect the patients with the clinicians and get the information that they need. We've gone completely digital, totally virtual, and it's actually been incredibly positive. We've launched new social, so if you check out our Instagram, we've got a lot of conversations between peers and pros, really getting all of this information directly to the consumer, which I think is helpful in the same way that I hear Myra and Michelle talking about telehealth and Karen talking about virtual teams. I think that having the consumerization of healthcare is a big part of what we're seeing in med devices. And so making it really easy for clinicians to talk to patients and patients to find the work that they need, the help that they need, I think needs to have always to have been more virtual. Yeah, so that's what we've been focusing on.
You know, I think that was one of the more interesting aspects of our prep call the other day, and how all of you had a more focused look on the consumer. And when we talk about customer, and in this session, I was envisioning the customer to be the healthcare, you know, organization, the doctor, the hospital, maybe the payer in some sense. But I thought it was an interesting point you started, and I think I'm going to go back to Michelle and Myra on this one, and get your thoughts around how your organizations are now sort of focusing on the consumer as well.
Yeah, I'll go ahead and start, and then if that's okay, Myra.
Yeah, no, go ahead.
You know, when we started our Center for Innovation, we really much focused in on the patient journey and how could we, you know, make it less frictionless for the patient with trying to access services at our institution. And what that meant was not necessarily, of course, getting that service within our 4 walls, but if you did have to come in, you know, how could we make it more touchless? I mean, even before COVID had started, you know, so yes, we focused in on the patient, but I will tell you, it wasn't just about the patient as well. It's been about the employees, potential employees, also our clinicians. The physician's journey for us is, Dr. Mark Boom is very interested in getting our physicians back in front of the patient. And not necessarily on the computer screen, looking at the EMR, asking questions or doing whatever. So, the two, pilot projects that we have going on right now, one is directly just with Amazon. The other one is with Amazon and Parveda. It has to do with voice technology in the ORs, having, the physicians be able to call up images, call up labs, whatever they need to without necessarily having to touch the computer. And the other it was with ambient listening. And this is where it is that we're really trying to get our clinicians back in front of the patient, without having to necessarily touch the computer screen. So, for us, it's several journeys. It is the patient journey, and we're still very focused on that and how we can make that better, easier, because we all know there's other organizations out there who have not necessarily been in healthcare before that are now within our space. So how can we make that better for them so that they will continue to come to our healthcare institutions? And then, of course, as I said, with the clinicians and the employees.
So Michelle, how are you all sort of ideating and getting the technologies to support your efforts here? Is there some way to go out and look for very interesting and novel ways to engage your employees, to engage your customers, to focus on that customer experience? We will have startup folks in our audience. And so when they look to knock on your door, what does that look like? And this seems like a good example and a priority space for you guys.
Sure. I would say, again, it kind of goes back to what's our model of looking at, new technology that is out there. I mean, first and foremost, I will tell you, I am always looking. I'm always looking to what is, the latest and what, technology that vendors have to offer. But it also has to be solving some problem for our institution. And, that is because you can get caught up with all of the glitz and glamour and everything that's going on with digital health innovation these days. So, when we try to go out and look at different vendors, or vendors want to come in, where I try to get to understand from them is, what are they offering? And is what they're offering offer some solution to a problem that we're having? And if so, how can we bring them into our overall Center for Innovation, our technology hub, and let us try it, let us see it. I mean, I will tell you, brought in certain vendors, and while we thought it was really good, our clinicians or whatever, didn't quite feel like it was a use case where they wanted to see the technology. So we've had some things that failed for us and a lot of successes. But, from just what's new, I would say to any of the startups that are out there, we're always looking. I'm always willing to listen. I can't always guarantee that, it will result in, some partnership with us, but always willing to listen.
Great. And it sounds like you're willing to listen, and for the startups that are that have your audience, they better understand the problem really clearly and have a compelling solution for you guys. So that's helpful to know. Myra, your thoughts around the same kind of question?
Yeah, I echo pretty much everything Michelle said. Our focus pre-COVID has always been on the consumer. And we actually have looked a lot outside the industry of healthcare, because as Michelle said, there are those that haven't been in healthcare a while and now have entered into healthcare. So it's been really important for us to focus on that. We're also not just looking at the patients just for the patient's sake, but we're looking at demographics, we're looking at populations, we're looking to really target and almost put a product in front of patients in the community in terms of what they're dealing with at any particular time. So we're looking at them by zip codes, et cetera. So from a digital world, we're really trying to get to them before they get to us. So it's more of a pull versus the push and come and look for information. That's been pretty important. Now, all of that sit on a significant, robust data analytics platform. I highlight that because the only way organizations will become intelligent is to be really smarter and get insight, to have foresight around data. I share that with anybody that's on the call, on this webinar. From a startup standpoint, there's a huge opportunity in healthcare to make us smarter, faster. Why? Because we can become more competitive. We can understand specifically around specific areas that are needed. That's really important, and that's been a really big focus for us also. I will also echo what Michelle highlighted in articulating the problems that we're trying to solve. We have an innovation hub. We try to keep a portfolio of opportunities that we have, and we want to make it bi-directional, where we have internal workforce that will go out and talk to different startups. We also want to make it welcoming, so when startups approach us, we sort of look at an immediate list of opportunities that we have to really understand, is there something that we can engage in? And if so, we continue. If not, then we at least have an idea at that particular time. And that also allows us to solicit problems that we can solve from our organization. And we maintain that portfolio ongoing, so that, because we know startups are around, there are more of them. And so we want to just continue to keep that portfolio in front of us, so that we can have a robust discussion when we approach them or they approach us.
Great. Okay, thank you. Very, very helpful. I'm going to jump over to Karen for a minute and talk about, you were talking about customers. So I think your customers are predominantly payers, right?
Yes.
And so when we hear from the health systems in terms of how they're looking to engage with startups and where their priorities are in terms of the problems that they're now solving, how do you see things having changed with payers and from as a vendor to payers? How are you looking to engage them? Is that dynamic changed significantly since COVID?
Again, trying to engage them is the thing that has changed. Usually you'd go and have lunch and have a meeting, and now you're doing a virtual meeting. So similar to a startup, getting them engaged. We look at trying to solve problems for them, meaning the utilization management, new things that they may be struggling with, making sure that they are delivering a quality healthcare. So things like genetic testing, which is an ever-evolving type of medical problem. And so engaging them and trying to see what their needs are as a payer, where they're struggling is where our niche is. We do subspecialty only. We don't do just general utilization management, but we focus on areas that are very complex in the healthcare system. But we suffer some of the same problems as trying to engage them. We work from a network that our sales team has, and we just continue to try to call, but being innovative in that area is certainly something we're looking to do.
Okay, thank you. And Tracy, your role at AdvaMed, right? And so you're working with a number of colleagues who are in the device space. What do you see as things that have helped the group sort of move forward? Because I think devices, everything that we're talking about at this moment seems to be sort of the information, the technology, the patient experience, and devices seem like they may have a greater challenge in today's environment. Would love your thoughts around that and what you're seeing with the AdvaMed group.
Yeah, well, I think it's worth maybe just spending a little time talking about the way we see medical devices playing in the space. So I tend to think of it as supply side and delivery side. So hospitals are on the delivery side of healthcare, and medical devices are on the supply side, given the things they need. And so I think Michelle used the word frictionless. We want to make that as easy as possible. So there's a few ways we play right now. We have a second product, for example, also that you can see on our website, but it's for preventing pelvic floor injuries during childbirth. And we have a clinical trial actually going at Texas Children's Hospital through Baylor College of Medicine. And I was incredibly impressed with the way that went. And a lot of my colleagues in AdvaMed have been less fortunate. I think we had really great partners at Baylor and Texas Children's and Ben Taub to respond pretty quickly. We went on pause for 3 months but then we have been able to start back up. We're also fortunate in that childbirth is essential. So, and we expect more babies.
Can't reschedule that, can you?
Say it again, Aisha.
I said you can't reschedule that, can you?
Reschedule. No, they wait for no one. And we do expect to see more of a baby boom after all of this. So we had all of those same challenges that everyone's had in terms of making our team virtual, and then also helping patients have as little access to the hospital as needed. Fortunately, our device doesn't really require any extra touch. It's used in the normal workflows of labor and delivery. But what I've understood from my colleagues in AdvaMed is that the companies, it seems to me that were hardest hit were the ones that are sort of in the $100 million revenue range, where they have products, they have expensive sales forces that are there to meet with the clinicians and the hospital value committees and do all that work, and they were non-essential employees. So they are not admitted to the hospital, and now the supply side of medtech has been pretty deeply disrupted, and that's been a pretty painful thing. But for those of you who don't know, AdvaMed is the Medical Device Trade Association, so it's really the clearinghouse for all supply side med device companies. And we shared so much information, and actually AdvaMed has done an incredible job of pivoting towards COVID. So to your first question, when we just kicked off this webinar, was what were you planning to do, and now what are you actually doing? AdvaMed certainly rose to the challenge of the whole industry, making sure we had enough ventilators, personal protective gear, helping get the supplies to the hospitals that they needed. So there's a lot that's happened, but it has certainly not been a boring place in medical devices this year.
And I think about devices that are in the pilot process, as you described your pilot process with Texas Children's, and it sounds like you all have navigated through sort of those early days where there was so much uncertainty and trying to determine what's safe and what can happen in a hospital, what's essential, what's not. What would you, as far as guidance to other startups who are in sort of these pilot relationships? I'm going to ask this of Myra and Michelle too, because I'd love to get a sense from their portfolios. I'm sure they're all working with pilots. So what has worked well, Tracy, in terms of keeping that relationship intact? It sounds like there was there was a little while of being sidelined, if you will, but then you guys are back working together. What are some tips you can give to people to help kind of reignite those types of projects, pilot projects?
Well, I think that one of the things that's really worked very well between us and Texas Children's and Ben Taub and Baylor College of Medicine has been really trying to understand the other party's problems. But I think startups and med device companies, we get very distracted with our own world of getting clinical data and getting through the regulatory process and get a go-to-market strategy, and all that stuff has nothing to do with adding value to a hospital. Right? Hospitals have their own lives and issues, and I think having some cognizance of the challenges, and then they have been incredibly thoughtful about us too, understanding that we're a startup, we're venture funded, we've got a burn rate, and we're now no longer hitting our milestones, and there's just been an incredible amount of positivity and sympathy and just going with the flow, and that's what I would really recommend, just remembering the other person's point of view and also just being really communicative and positive.
Yep, that's great. Helpful tips. Myra, anything to add to that?
No, she started it by, again, I'll echo, it's really important to understand the problem that you're trying to solve. I think that helps, and if it's a really viable problem and you know the targeted audience, the rest will take care of itself.
So if we look at sort of portfolios for, and I don't, Karen, we'll see if this fits for you too, but I know for TCH and for Methodist, you all have a variety of startups that you're working with. I'd say there's a portfolio of different people, different companies working on different solutions. How does that work through your innovation office? Do you keep sort of a tally of all the different projects that are underway and evaluate how they're progressing, so you know how to put resources against those that best meet your needs at the time? How does that, is there a process like that? Let me ask that question first. Michelle, I'll turn to you for a minute.
Sure. I mean, it's a really good question. Yes, we do have a portfolio of kind of the things that we are working on. And matter of fact, we have really lined out what our rest of our goals are for this year and kind of starting into 2021. You know, there's not a lack of work and things that we're trying to work on for innovation. You know, I think I've told you our main focus is really working on overall this voice technology. AI is going to be another, and Myra kind of touched on it about, you know, with data and how data is really important to organizations right now. You know, and then how are we better just overall engaging our patients? And you know, we're constantly looking for ways that increases, you know, their ability to get with Houston Methodist and the services they need as the least frictionless as possible, right? I mean, if it's difficult, you're not going to do it. And so we're constantly looking how we can improve that process, you know, for different types of services. I will tell you, we've got a whole kind of wayfinding, you know, process of looking at when a patient, not only are they able to schedule online, they're able to pay online, they're able to upload and, you know, finish out questionnaires and do all of that. But once it's time for your appointment, then you get a notification. It gives you the directions to the hospital. And then, of course, anyone who's been at the Texas Medical Center know that it's not the most easiest in figuring out where you're supposed to park. But this will tell you exactly where you need to park based upon where you're going, whether it's to a clinic or it's to one of the outpatient services. And then once you park, it will tell you the directions to exactly where you need to go to. So again, trying to make that journey just kind of seamless as possible, as easy as possible for us.
You know, question for you is this whole symptom checker and navigation, which is interesting. And I wonder what you all think about that. And if you've seen anything that has, you know, wayfinding is one thing, but if I'm sick at home and the best thing is a virtual visit for it to connect me, but if I need to go to the emergency room, then it can help me get to the right healthcare resource. Have you all seen anything like that that you found interesting? Is that on your radar screen?
Well, I would tell you what we're using right now to help. You know, there's it's to help with the ED wait times, and yes, we do have that. We're using that. The symptom checkers are. We're using a product called Buoy. We're using that for actually our own employees. You know, because they have the exact same questions that, you know, the patients or consumers are having as well. And so it's just to kind of help them. And we're using another product kind of out on our website. It's called Syllable. And Syllable is another way for the patients to be able to start to interact. And it's a chat bot. And once you reach the point that you need to actually talk to a person, it will get you to that person. Or it may, you know, send you off to, you need to see a physician. So again, if you stop and think about just the ease of use of not only getting the information you need, but sending you where to the right location that you need to go to, whether that's a telehealth or you need to actually go to a facility. I mean, those are the things that we're focusing on, kind of on the patient and employee side. And then how are we, you know, again, better engaging the clinicians to make their process smoother within the organization of taking care of our patients. And so it's just a combination, I would say, again, of there's lots of new technology that's out there. And we're constantly searching if it's not one that we're piloting. And I will tell you, some of our pilots, as I've told you before, they didn't quite make it. So, you know, but we learned from those pilots, and now we're moving on to see, you know, how we can utilize that information to, you know, make it better for the next pilot that we do.
Do you publish that information anywhere in terms of the the list of challenges or problems that you're seeking solutions for?
You know, we do have our website that's out there for the Center for Innovation. And I do think I would have to look at, I do think that we've, published some of the things that projects we're working on now. I will tell you all of the problems that we're trying to solve. No, we probably don't have that out there at the moment. I think, again, it's one of those things. I'm sure Myra and probably everyone else on this call are constantly being asked to talk with different organizations. And I'm more than willing to do that. Matter of fact, I've got a call a little bit later, right after this one, to talk with an organization. But it's just as Tracy said, and I know Myra has this just as well, and probably Karen, if there's not a problem in my institution that your product you're trying to sell solves, I'll probably keep it, like Myra says, kind of on the back burner over here, just in case if something does come up. But we're very, very focused on trying to solve those problems. And my problems are probably very different than what Myra's problems are, maybe some similarities, and again, with Karen and Tracy.
Thank you. I'm going to jump to Karen for a moment because Karen, you were in a position where you were a VP of medical affairs, or chief medical officer for a health plan. So yes, you have insights into the organizations that now you are selling into. If people have interesting sort of startups that could help leverage your particular product or solution, are you involved in sort of searching for those types of things? Give us a little sense of how you engage, because you changed seats.
I changed hats a little bit.
Hats, there you go.
Yes, having a little insight, intel into the payer world for now who I serve will be and has been a help. So yeah, I can help direct. I know that my former colleagues, where their struggles were. And so, yes, I'm actually kind of navigating that and trying to find solutions for that. And their struggles aren't different than a lot of payers. So using that intel is certainly a help. As far as devices, I know also where the struggles are with regards to technology, and in the payer world, it is data. You have a whole bunch of it, and trying to get some sense out of it is I think, with any large company, the struggle that is ongoing. They always tell you in the interview, oh no, our data's great. And you get there and you're like, yeah, you've got too much of it. And that's all I can tell you. It's great, but too much. So those are the things we're looking at. And the problem is across the board. So
will your company partner with companies that have sort of early stage data analytics or efforts that may support, like the other, what kind of companies can come knock on your door? Do you need it to have some proof of concept, or are you able to partner with
a combination? I mean, there's certain things, when you're looking at data in any healthcare, you've got to make sure that security is key, high trust, and all of those. I mean, that goes across the board. So it does make you a little leery sometimes when you're talking about data with a startup, to make sure that they can meet those criteria, because you are dealing with personal, private information. But if they meet that criteria, yeah, I mean, any, platforms that our nurses who are doing reviews can access, that then the medical directors can access, that then the payers can access, all of those platforms that can move across companies safely, and can then transmit that data into something usable, where that there's an overuse of this type of technology or this type of medical processes, are important things that we want to look at. So it's teasing out the data, seeing what's impactful, looking at overuse, underuse, inappropriate use, and teasing out where we can have impact. Those are the kind of platforms that we're looking for. But the key first in the healthcare is obviously security.
Great, thank you. And Myra, back to your portfolio, how you're managing all of that, and whether you guys publish a list of key problems, how that works for you.
Yeah, so the process is, we don't have a department. We really took a very innovative approach to addressing innovation at Texas Children's, because we have so many innovators. We really went down a path of, acknowledging that everyone is responsible for innovation. So we didn't want it to be seen as this department, and because it's in my title, that's the only innovative person on earth. That is so not true, and that is not how we wanted to start it. So we created sort of an advisory hub, and we sort of look at that as the hub, and then there's the spokes. And the spokes are individuals that are in departments, clinical, operational, that have been seen as that resource to express, I have an idea, have you ever considered, etc. We sort of partner with them, and we allow them, we give them a process, a really quick methodology to just identify, solve the problem. What is the problem you're trying to solve? So if someone has an idea, get them to really articulate that. And if it's worthy enough, we'll look at it as an innovation hub, and we'll go through the discovery phase of it. This is where we begin to create a portfolio. We also have an understanding of who our partners are, because in some cases, a solution may be right there at their nose, at their fingertips. A solution may not be digital. A solution may just be, you might really need to make some changes. So we sort of foster the world of innovation beyond just the digital world. We foster it in terms of a learning environment to where it means you just need to change a workflow. So it's a group, it's a hub, but there's a lot of spokes, and we have a really quick process by which we go by, but we don't publicize it. We don't make it public at this time. You're on mute. Aisha, you're on mute.
This is such a problem. So we now have 14 minutes, and we had a number of calls that were really kind of seeking career advice from all of you, kind of the how did you get to where you are. But I think the one that caught my attention was, what has been the most impactful decision in your career or business journey? And so I would love for each of you to kind of give us some background for how'd you get to where you are? Is there a decision that was a memorable decision that was a turning point for you? So Tracy, I'll start with you.
Taking myself off mute. You know, I think that's such an interesting question. For me, it would be when I sold my first company. I started, so a little bit of background, my undergrad is chemical engineering, and I started life in big pharma, designing heat exchangers and pumps and launching products all over the world, and but on the tech side. And I after 5 years, had a wonderful career there. After 5 years, just decided I want to start my own thing. And I just went and did that. And those were during my childbearing years. I had my 2 kids at that time. And 5 years into it, I just decided I wanted to go back to working with teams and not being the only person making all the decisions all the time. And I sold that company successfully with help from friends. I had never done that before. They don't teach you how to do that in engineering school. And so, but it was such a great experience. Ended up selling for 7 times EBITDA, an unexpected and wonderful experience. And I realized that I loved business. And I went and got my MBA at Duke. And that was also a really great decision. And I guess making that choice to be a business person rather than a technical person, hard to go back. And there are some days that I do miss the concise reality of just engineering something, because business is a big, floppy, crazy thing. It's been really great. That was probably my biggest moment.
Great. Thank you for sharing. So when did you go back to business school? How long ago?
I graduated 10 years ago.
10 years ago. You know what? So did I. After what? I'd been in healthcare for so many years. And when I saw consolidation and saw all the different problems that were being created, some good things, but also some really entangled issues, I felt like technology was going to be the enabler of transformation. And I had to go to business school to kind of clear my head of healthcare things. So they're big decisions and they're big commitments. Yeah, that's great. Thank you for sharing. Karen, your story.
Well, I think as a young age, I always wanted to be a doctor, but my vision as to what I am now, I never could have thought of. And I guess my advice to those who ask that question is to always keep your door open. And the way I got into managed care into business is that one day the power went out at my office, and I was sitting in my car because I couldn't work. They shut me out of the building, and I get a call from a former residency colleague, and she says, "Hey, Karen, I have a job for you." And I said, "Well, I'm not really looking for a job, but what do you got?" And we had a conversation, and she was a part-time medical director for a managed care company. And I said, well, you know, it can never hurt to have that conversation. So over breakfast coffee, I met my new boss. And I ended up doing a wild thing, I owned my practice. I was a sole practitioner. So I did that part-time, and I worked for AmeriGroup part-time as their associate medical director, which launched me into managed care. And I always kind of had a sense for business. And I knew at some point I wanted to go back for an MBA. My dad was a business person, and I felt that physicians just in general, and please don't shoot me if you're on listening to this call, but you know who you are. You don't know business, you just know healthcare. And I think that sometimes stabs us in the foot. So while I was crazy and having kids and having a job that I wasn't looking for and starting a new job, I went back to business school as well. So I graduated from U of H in 2007 while working part-time at my practice, part-time at AmeriGroup, and having 2 small children. I thought that was fun. My husband, not so much. But if I had to have any advice, just answer the call, have the conversation, because your assumption about what it is may be totally off base, and their assumption about what it is they want may be totally off base. And you can somehow meet in the middle, and it turns out great for all of you. And I wouldn't be doing what I'm doing today had I not made and answered that call.
Great. Thank you. Myra.
Yeah, my undergrad is in computer sciences. So I started out as a software developer, and my pivotal, impactful moment was probably in year 3 of developing, when it became really apparent what I was developing was not being liked by the customer. And I had a translator. There was always someone in between me developing and the person who wanted the services of my material. So it became really obvious I needed to really walk away from developing and begin to talk to the customer personally, directly, and understand the problem that it was that they were trying to solve. So little did I know, over 30 years ago, I was really talking about the problem that we needed to solve. But I also learned during that journey that I didn't really like having a relationship with the computer. I didn't like sitting there coding. I wanted to talk to people, and I wanted to really solve problems and really make it more impactful. As Karen highlighted, though, I think what's really important is my journey started in Louisiana and led me to Northern Cal, then to Minnesota, and now I've been in Houston for 20 years. I share that because I could have always said no to every opportunity, but I chose to embrace it. I was a trailing spouse. Actually, I think I benefited more out of it than he did now. And so along that journey, I've met so many people. I've embraced the world of just really working with people to solve problems. I went into consulting, spent a significant amount of time in consulting. While in Minnesota, I too decided, after living in a new state, having a newborn, I would go to grad school in Minnesota, where it became challenging, as you can imagine, 9 months out of the year with lots of snow. I share all this to say I embraced all of it to really have fun. And I think the reason I'm here today is because I just don't say no to opportunities. I think you always leave the door open. You always look at possibilities, but it's always an engagement. It's always fun. I love what Michelle said. She's been at Methodist for 20 something years. I said I've been at Texas Children's for 17. I feel like I could say I just started yesterday, but they won't let me because sometimes I go, where did that come from, right? So I think, though, that has a lot to do with our attitude, your disposition, your welcoming, your learning, constantly learning. And I encourage anybody on the call to just do that. Just always leave a door of opportunity to learn.
Thank you for sharing, Myra. And last but not least, Michelle, your thoughts.
Yeah, I think it's a similar story to everyone else. I will tell you mine's a little different. I started out in technology. For those of you all who remember compact computers, was there for many, many years, had a very rewarding career with them. But during my time there, and Myra, you may appreciate this, I had my firstborn, and he had health problems and had to go to Texas Children's and was there for a little while. And I will tell you, once he got past the critical state, both my husband and I were just very overwhelmed at the care and that, you know, our child received, all of the support that we got from everybody there. And we were just, and he was at Compact as well. And we were both just so overwhelmed at how that experience was that we actually wanted to get into healthcare. We kind of chose different paths on how to do that. And so that's where I started my career 27 years ago at Houston Methodist. And, you know, the only thing that I could tell people is, you know, I think what drives us all is the passion that we have for what we're doing. Most of all, I will tell you the passion that I have knowing that while I'm not doing direct patient care, what I am doing is helping for the care, you know, that we provide. Methodist has been very great to me. I wouldn't be there, I guess, for 27 if they haven't. I've had lots of different opportunities. And where I would say kind of in this innovation space, the 2.5 years ago, there were probably a few of us, you know, this buzzword was kind of going around with digital health technology and what was that? And so, you know, we were just kind of researching and sharing different articles. Roberta was in on that. And so there was probably about 5 of us that said, hey, let's just start meeting. Let's start talking about it. And before you know it, we created this group. I think many of you know, we call it our DIOP group, which is our Digital Innovation Obsessed People group, that we later, you know, really coined as our Center for Innovation. But, you know, kind of what you heard as a theme from everybody, don't ever pass up an opportunity. There's multiple ones that are out there. Make sure that you're passionate about it. It really helps to open doors for you. Sometimes there's scary doors that open up, but continue to go through it, especially if it's something that you're passionate about.
No, that my son, who's 32, we had this thing on our refrigerator that said, do one thing that scares you every day. So, you know, unless you take a chance, you don't get these great opportunities that each of you have had. And thank you so much for sharing your journeys and your insights and your advice. So we have had an incredible conversation, and I just want to thank each of our panelists for taking the time. I know you're all very busy these days, so we appreciate the time with you. Now you can hear my dog, who has a comment about the whole thing. He loved it too. So I want to thank again the TMC Innovation Institute. They have been an incredible partner for Ignite. The audience, thank you for joining us. We have 2 more webinars in this series. One that's going to be next is on August 6th, moderated by communication strategist Kelly Newman. And she's got an incredible panel that'll talk about some of the challenges and opportunities in the way to communicate in this new environment. And then our 4th and final seminar or webinar will be on August 18th, 19th. I'll get the information out. And that's a business roundtable led by Dr. Juliette Breeze, who is an entrepreneur herself. And we'll have a number of startups and companies that are grappling with the very real business issues. We will also have one of our favorite bankers from JP Morgan join us and give sort of the bankers advice. So we've got some great webinars coming up. So thank you so much for joining us, and we look forward to seeing you at future webinar sessions. Have a great afternoon.
Thank you for having us.
Thank you.
Bye-bye.